This month, the American Heart Association and the American College of Cardiology released new guidelines for high blood pressure. We have Dr. Kathryn Doss from University of Michigan Health-Sparrow here to speak on what this means. Dr. Doss, what is the new normal for high blood pressure?
So the new normal blood pressure reading is less than 130/80. If you're over that, you're considered hypertensive, and technically the normal reading is less than 120/70.
Why are we seeing these changes in the new high blood pressure than the previous guidelines? What difference does it make in increasing the high to 130 instead of 120?
Previously, the high blood pressure threshold to start medications was 140/90. So now the new guidelines were saying we're bringing it down to 130/80, as that's what you want to. If you are that, we start medical therapy, lifestyle interventions much earlier than we did previously, because we're finding that improved cardiovascular outcomes with people the lower the blood pressure.
For people with high blood pressure, what are the concerns for their overall health?
So for people with high blood pressure, they can walk around with high blood pressure and not know it, and it's causing damage silently, meaning coronary artery disease, which is plaque buildup in the heart arteries that can eventually lead to heart attack or stroke or even death. So it's really important that we control blood pressure so that we don't have these adverse cardiovascular outcomes.
And that's why the action that you speak on is crucial, making sure that you have that early detection, that awareness, and you go seek someone like a doctor for help.
Correct.
Anything else that you'd like to mention, Dr. Doss, in making sure that people are comfortable with their blood pressure and that it's not spiking too high?
The new guidelines actually put more of an emphasis on home monitoring as opposed to just office measurements, because we have a lot of people that have what we call white coat hypertension, where they go to the hospital or a doctor's appointment and their blood pressure is much higher. So they're really wanting people to monitor their blood pressures at home. And previous guidelines, they were not so much on home monitoring. It was more treatment based off of office readings.
It's about managing your own high blood pressure and having that awareness at home too, because it's not every day, or you would hope not every day, you're at the doctor. Dr. Doss, thank you so much for joining us on Mid-Michigan Matters.
Thank you.